Okay, we've got about, 15 to 20 minutes left. So there's 2 microphones on the side. I can also walk this around if people are more comfortable sitting. But questions, comments on any of those? Go ahead.
I had a quick question. Mark, you talked a lot about sort of the general cost of living stresses and kinds of things as being generalized stressors that apply specifically to our community. But I wondered, I couldn't help but think, and it's not something that had occurred to me before, but a lot of those stressors I feel apply to my life specifically because of things about me. Like, I guess I feel like I have to live in a city like Vancouver because I don't have a lot of other options. And so yes, there's high cost of living in Vancouver, and that's true for everyone that lives here, but I personally don't feel like I could live a lot of other places. And also I feel like I don't necessarily have a huge support network behind me. So if I miss a payment on something, or if I can't afford my rent, I can't ask my family to help or anything because of my situation. So I wondered if anyone in the group that you were talking to sort of delved further into the reasons behind some of those factors, I guess, or if that's something that you've thought about.
Can you hear me? So I think it goes back to what Trevor said, which was just around minority stress, which is there are stressors that affect everybody, but that are going to compound if you're dealing with a minority status, right? If it's harder to find work because you're discriminated against, or housing, etc. But the main push that I was trying to get is that there is this other, that this kind of broader context that we're living in as gay and queer men that we don't always theorize or think through. Or we say it affects everybody, but we want to focus on what's specific to us. But these things really matter to us. So it's about how do we theorize what's maybe exclusive or more pertinent to us, while also keeping our eye on these other issues. But thank you for that point. It's really helpful.
Hi, thank you for that whole presentation, because I just want to say that nerdy is actually sexy, not in the physical way, but also in the fact that the work is sexy. It's really important. And you kind of took thunder out of my question in a sense, but I'm going to reframe it because I'm a counselor, in the sense that I mean, with the election year coming next year, all the data that we've been looking at the summit can give good arguments for funding for mental health and the need for the things that you've been talking about. And so how do we do that? How do we frame this into campaigns and work? I think this is not the question for the panel, but I guess for all of us, in the sense, what do we have to do to bring this forward in terms of to advocate for more funding for mental health and the work we have to do?
One point, I know in Ontario that they're recently there's a big budget going towards mental health and the mental health push. So I think one of the things Engage can do specifically in other studies is making sure that there's a queer LGBT focus in how that money gets spent, both in terms of education. So as we heard from a last panel, like you need to educate counselors, and from offering services. I know.
And I think that there are things that we can do beyond waiting for the province to do things that we wish they would do. So one of the things that in Toronto we've been trying to do for some years, and notice my wording, trying to do for some years, and we're moving in that direction, is to have a gay bi queer men's kind of hub of services that would provide not only HIV or STI related care, which is excellent, but also would provide mental health and substance use related care, because we know all of these things are completely related for us. Maybe they aren't for you individually, and maybe they are, but at a population level, we know these things are related. So, you know, there are things that we're trying to do, and frankly, I want to give some credit to a lot of the people that are working from community-based organizations that have moved from kind of older models that made very good sense in their day, like when we were all passing out condoms and having, you know, huddling for support under a different kind of epidemic, and now moving to discussing discussing not just about biomedical prevention, but also having counselors at some of our traditionally AIDS service organizations, or even having organizations that are not AIDS service organizations, but gay, bi, queer men's health organizations. I think that stuff is really important. We're a little bit behind in Toronto, but we're moving in that direction too. I want to also build on the first question and also some of the great things that Mark was presenting. We have actually done some studies that have taken a look at things like you mentioned, like social support, family support, friend support, and kind of being able to call in your neighborhood for support, including financial support. And one of the things that we found is the more of those things that you have, at least in terms of safer sex, people are actually more likely to engage in safer sex. So, and that was, again, it was kind of in the pre-PrEP era, so it's unclear what that means, safer sex, even in the PrEP era. So we have to learn more about that and be more nuanced and complex. But we also know that there's some association with having less mental health problems when you have that support from your family and from your friends and from the neighborhood. However, I'm also really struck by the same things that we often don't have when we have to leave our families in order to like find a safe place. And I know a lot of us have done that. We had to like literally go to another city to come out, where some of us actually did that because it was not safe to do it in your own city. So you lose some of the family support. And then some of us have moved around a lot, so your friend support, like I have, for example, I have friends in so many different cities, but then that also decreases your ability to have friends in your own city because you didn't grow up with all those people. And so there's that issue, and also just the mobility that we have can also decrease our ability to call on our neighborhood and to know what's available in our neighborhood, and also kind of can create a sense of kind of alienation and anomie, like kind of like not feeling attached to your own community. So the same things that we do as coping mechanisms as gay, bi, queer men sometimes can also increase our social isolation, even though that's not what we wanted. And so it's our responsibility in the community to try to do what we can to build that support, you know, have those family by choice kind of stuff, to build social relationships and to decrease social isolation. And I think that many of our community-based organizations, as I've said, are working toward that.
And I just may add, as a community organization in Montreal, what we plan in the future with the data that has been presented here by Engage is, first of all, we are going to give those data to the community. We have the community engagement in Montreal that we are discussing how we could do some events or stuff like that. And just small campaign, just saying, you live that, and there's a lot of other guys who live that. Like those kind of research is just good to put your finger on something that we all know exists, but there was no data to prove it. So this is something first we are going to do in the next years to come, and it's just proving we are going to use it in our negotiation with the public health, because there's been a low decrease of the incidence of HIV during among gay men for the last 20 years, and this is not because as an organization we didn't do nothing and our work didn't work, but the focus on the funding was only in distributing condom and stuff. So it just goes into the narrative that we need to take care of all those issues to be healthy as a community. So yeah.
Other comments or questions? I guess I'm curious if anyone in the audience wants to talk a little bit. I know there's different people in different positions and work, but do want to talk about any recent trends that they've seen in their work, particularly related to mental health. And we didn't spend a lot of time talking about substance use, but just if that would be helpful to talk a little bit about. Yeah.
I was just doing some interviews in Toronto, and there was one guy, and he had substance use disorder, and he wanted to get some counseling about it. He also had some other mental health issues. So mental health issues are correlated with HIV risk as is substance use, and he couldn't afford to see a counselor, and he didn't like AA or NA or those kind of faith-based things. And so it wasn't until he got HIV that he got access to this kind of funding or these kind of services where he could get counseling. So it was kind of ironic in that way. I just thought that was kind of.
And also I want to build on what Nathan's question was, which is, you have a bunch of people here that like analyzing data. So maybe you have some ideas as to like, what do you think, what are some ideas that you think we should be doing? This is another chance for you to kind of shape what the future research looks like. And if we have the data and engage, like we're paying a careful attention. Like, you might not be on one of our community engagement committees, but if you're here, you're a member of our communities. So if you have any ideas either in this session or afterwards, please approach one of us and we'd be glad we're gonna be listening, and maybe that will feed into the next papers that we write up that we then present to public health agencies.
Thank you. I've been very curious about having some of the first engaged results, particularly as well, like both quantitative and qualitative. So it's very exciting to start seeing some of those results. So in Ottawa, with Max, we started a year and a half ago a mental health navigation system. So where guys who don't know where to start, might have just moved to the city or might have had previous bad experiences with mental health service providers. So they come to Max, where with a mental health navigator, he navigates the system with them and finds the best possible match with at least 2 options for depending on the budget, the language, the specific need. And before doing that, of course, we try to do an environmental scan of services, what's available out there to know where we're gonna match. And both from that scan as well as once guys started coming, and with very little advertising, we have at least one guy a week in a slow week coming for that kind of service. And we've noticed a few things. One is some of the specific needs or realities there's like just gaps, right? There's guys that want to talk about racism, and they don't want to talk to a white counselor, and there's very few counselors of color, or at least in their first environmental scan. So now we're like looking everywhere, where are the available counselors of color as one of the examples. Specifically around sexual violence as well in Ottawa, there's one of the limits that we've noticed of counselors that will understand the reality for guys into guys. Party and play, definitely as well, one of the gaps where guys don't feel comfortable going to some of the traditional addiction services or some of the 12-step programs that for some guys don't work. Other ones are really happy with that and that works for them, but for others it's not working. So I think the systems work or the networking with partners and tables and constantly working with others, not only to build competency or to do trainings that sometimes we think it works in sometimes, but with rotation it might not always work. So going really from the founding of education of all healthcare service providers and social service providers so that they gain that knowledge, as well as being part, hopefully, in partnerships with the hiring of counselors, in this case, that would respond to the needs of our communities, right? So that's where we're pushing to work with counselors, where whenever they're gonna hire a new one, can you include us, please, so that way we can feel more comfortable referring to your services. So those are some of the things and all of the things that you were saying, it definitely resonates with the things that we've been seeing, that we've been living. And the other thing that I wanna mention is I was really happy that you mentioned, Mark, around the minimum wage, because not only about that, but there's several issues around policy making, around advocacy that we still need to be putting our work on. And I think that it's part of our responsibility and our engagement as community members, as researchers, as community organizers to organize ourselves and keep pushing in some of those policy changes, because we can be doing some patching here and there to have our communities feeling better and some of the individuals, but if we're not really going further and beyond, then we're not going to see a real change. So I think we need to be positioning ourselves and organizing to get some of those changes.
I think the disorganization of services in Toronto is really horrific, where people, like literally the left hand doesn't know what the right hand is doing, and also there's 5,000 hands. So we've had repeatedly where people are like, there's nothing available in the city, you know, to talk about this, and we've had like, we just finished our study, and it was free, and it was treatment, and it was free, and people were like, it's not available, and I'm like, wow. And then I know some people are like looking for clients on the Toronto Queer Therapist listserv. They're looking for clients, and then people are like, there's nothing available. And I think people just don't know we need more mental health navigation. So bravo to Max yet again.
Sorry, go ahead.
Just to add to that one comment, because when we presented this at Community Forum, there was somebody, a service provider, was just like, so you have all these people saying they can't access stuff, but I can't get clients into my free counseling service, or people don't want to come to this ASO, et cetera. And so I think there has to be a bit of a messaging shift about, because some people, what they want is they want a counselor or a psychologist that they could go for a very long period of time, which is great, but maybe there is an advantage to seeing somebody for 2 or 3 times to get a sense of what it is you might need, to get a sense of navigating where you might go. And so instead of just being like, I don't want that because it's only 3 sessions or it's at an ASO, being like, there's an advantage to doing that as a start so that you could think about what's next. So maybe that's one way of messaging or thinking that might be helpful. So.
Okay, so I just want to respond to that first and then make my comment or share my thoughts. I think maybe there needs to be more work around promotion because a lot of people don't know what's out there in the community in terms of what's there and if it's there. I just want to share something like my husband, he tried to access support from extended medical care and so he got some counseling, but it wasn't effective for him. And then it ran out and then he can't afford it. So I think that, okay, fine, there might be some counseling there out in the service, but it's not competent counseling, right? Through our workplaces and things like that. So I think we have to look at that and advocate for more competent counseling for our community through our workplaces, and the fact that, you know, it should be better funded, because if this is limited, then you're kind of giving them some counseling and then you're letting them hang, and that's really detrimental.
Do you want to just make your last comment, and then we'll see if anyone has anything they want to say?
I'll totally take the last comment. Yeah. Mark Randall from HIV Community Link in Alberta. Just as an option or a suggestion or something that's happened in Alberta, 2 years ago, Alberta Health Services created a GSD, Gender Sexual Diversity Advisory Board, to Alberta Health Services. And we as a collaborative group looked at all of their documents, their language, their training, offered suggestions and changes, and they've done that process. Including language and competency in developing tools for their frontline staff at every level of AHS. So from the person at the front desk taking you in all the way up to the person conducting your surgery. They're now creating a provincial advisory board to AHS to do this work. So I think that mental health, PEP, all of these are discussions at this table. So maybe that's an opportunity to look at in other jurisdictions as well.
Thanks, Mark. Okay, we are at 1:15, and I know it's lunchtime, so I think we'll wrap it up, but we're happy to stay around for a few minutes if people want to chat with us.